My name is Maria Monterosa and I will be presenting on autism spectrum disorder. Autism spectrum disorder is a developmental disorder marked by extreme unresponsiveness to others, severe communication deficits, and highly repetitive and rigid behaviors, interests, and activities. Symptoms appear in early life, usually before the age of 3, first identified by psychiatrist Leo Kanner in 1943. According to the DSM-5, the diagnostic criteria for autism spectrum disorder is presented in the following. A. Persistent deficits in social communication and social interaction across multiple texts. They must include all of the following. Social emotional reciprocity. People with autism spectrum disorder have a difficult time with reciprocating emotional interactions with others. They have a lack of interest in both people and activities. They cannot maintain conversations with others, and they have abnormal social approaches. Nonverbal communication behaviors used for social interactions. They cannot understand nonverbal cues, and they have difficulties in trying to maintain eye contact. Developing, maintaining, and understanding relationships. They have a lack of interest in maintaining relationships. They have difficulties with initiating interactions along with abnormal ways of doing so. The next diagnosis is B. Restricted repetitive patterns of behavior, interests, or activities. They must have two of the following to be diagnosed. Stereotype or repetitive motor movements, use of objects, or of speech. For example, I had a friend who would always sing the Elmo theme song repeatedly, and this is a perfect example for echolalia, which is the exact echoing of phrases spoken by others. It can usually last days or a few months or even more. They may also present self-stimulatory behavior, such as jumping, spinning, arm flapping, rocking back and forth, and much more. They also present self-interest behaviors, such as banging their head into the wall, pulling their own hair, or biting themselves, and much more. Inconsistent on sameness, inflexible adherence to routines, or ritualized patterns of verbal or nonverbal behavior. They have specific routines that need to be followed, and any small changes can initiate extreme distress. Transitions can be very difficult. Highly restricted, fixated interests are abnormal in intensity or focus. So, for example, I had another friend who was obsessed with the public transportation systems in Los Angeles, and he knew all the routes, the bus stops, and the types of buses, including the years they were made. Hyper and hyperactivity to sensory input or unusual interest in sensory aspects of the environment. Next on the diagnostic criteria is C. Symptoms must be present in early developmental period. D. Symptoms cause clinically significant impairment in social, occupational, and other important areas of current functioning. E. Disturbances are not better explained by intellectual disability. So, dysfunction in certain areas are not because of developmental delays or intellectual disability. Now I will be discussing the prevalence rates. Today, 1 in 600 children have autism spectrum disorder, and that is the same as 1 in every 88 children. They make up the 1% of the world's population, and around 80% of all cases occur in boys. Additional information. Autism spectrum disorder also encompasses early infantile autism, childhood autism, Kanner's autism, high-functioning autism, atypical autism, child disintegrative disorder, and Asperger's disorder. What are the severity levels for autism spectrum disorder? According to the DSM-5, the first autism spectrum disorder level is requiring support. They have difficulties initiating social interactions, such as difficulties in having friends. They have decreased interest in social interactions. They have difficulty with switching behaviors. All of this can cause problems on organization, and planning problems can hamper independence. The second level is requiring substantial support. Deficits in verbal and nonverbal communication skills. Social impairments even with supports in place. Limited initiation of social interactions, such as reduced or abnormal responses, and responses can narrow to specific interests. frequent, frequent restricted and repetitive behaviors, distress and or difficulty changing focus or attention. The third is requiring very substantial support, such as severe deficits in verbal and nonverbal social communication skills, very limited initiation of social interactions, minimal responses, and great distress and difficulty in changing actions or focus. Then there is differential diagnosis. Selective mutism. It's a childhood anxiety disorder characterized by a child's inability to speak and communicate. However, there are no repetitive behaviors present. Intellectual disability, intellectual developmental disorder. And there is no similarity between social and intellectual levels. Rett syndrome, a neurodevelopmental disorder that affects skills almost excessively. As it progresses, the child loses purposeful use of her hands and the ability to speak. Language disorder and social pragmatic communication disorder. So it's difficulty in using language for social purposes. There are no repetitive behaviors present. Schizophrenia, attention deficit hyperactivity disorder. It's a chronic condition marked by persistent inattention, hyperactivity, and sometimes impulsivity. They don't lack social skills and there's no repetitive behaviors present. Stereotypic movement disorder, which is a motor disorder with onset in childhood involving repetitive non-functional motor behavior. No lack of social skills. Treatments. There are currently no cures for autism spectrum disorder. However, there are alternatives. Cognitive behavioral therapy. Teach new and appropriate behaviors such as speech, social skills, classroom skills, and self-help skills. It also reduces negative and dysfunctional habits. Therapists use modeling and operant conditioning. LEAP. LEAP is a program specifically for preschoolers with autism. They mix autistic students with non-autistic students in the classroom, and the non-autistic students help teach autistic students skills by using interactions. There's also communication training, such as sign language, simultaneous communication, such as a combination of sign language and speech. There's also argumentative communication system, and also communication training increases self-initiated communications, participation, language development. Parent training. Parent training includes behavioral programs, instructional manuals, and home visits by teachers and professionals. They also offer resources for parents such as individual therapy and support groups. There is also community integration, which helps develop skills in self-help, self-management, living skills, social skills, working skills, and the community services offered are in group homes, sheltered workshops, and the objectives is to have people with autism spectrum disorder to be involved within the community and to reduce the concern for aging parents who have children with severe autism spectrum disorder. That is my presentation. I hope you found it very informational. Thank you.